Okay, we welcome you to Module 7, the key concepts of home care. The goals are orient the participants to the basic human needs of clients, introduce participants to the concepts of personal-centered care, clients' rights, confidentiality, prompting client independence, teamwork, and professionalism. What are basic human needs? Human needs are the things that all people need in order to survive and thrive. The categories of basic human needs are physical, security, social, self-esteem, and self-fulfillment. In physical needs, it means maintaining the body's function. Examples are food, oxygen, water, elimination, rest, activity, sexual expression, and pain management. Security needs include feeling safe, secure, and protected from harm, physically and emotionally. Examples are having enough money to pay the bills and having a safe living environment. In social needs, it means feeling loved, feeling that you belong. Examples are having caring relationship, belonging to a family and a community. And in self-esteem needs, it means feeling good about who you are. Examples are knowing that people know and respect you, getting praise for good work. In self-fulfillment needs, means people need to develop their talent and pursue their dreams. Examples are learning how to do something, setting a goal, and then working toward it. Now, how you can help your client meeting basic human needs. In their physical needs, as a caregiver or a home health aid worker, you have to assist the client to the bathroom, assisting the client by preparing meals. You help the client to bed, position them comfortably, or help them to monitor pain and provide comfort measures. In their security needs, as a caregiver, keep the client's home free of safety hazards. Make sure you use proper technique when transferring client. Ensure safe ambulation. And you have to observe, record, and report the tasks that you have done. In social needs of your client, as a caregiver, you have to encourage visitors. Give and receive smiles and hugs. You have to show interest in the client. You may encourage the client to maintain family relationships. In his or her self-esteem needs, as a caregiver, you may call the client by his or her chosen name. You have to ensure the client's privacy. Praise the client reaching the goals that are in the care plan. And you have to respect the client's cultural background. In his or her self-fulfillment needs, you may encourage the client to spend time enjoying hobbies, and you be interested in client's life accomplishments. Let the client talk about his or her wishes or dreams. In person-centered care, clients and worker should create a schedule that fits the client's life. You have to have strong relationships, and if you have problems, you have to solve them together. In person-centered care, the home health aide treats the client as a person with unique wants and needs. The client has the right to choose as much as possible what kind of care he or she will get and is considered to be the expert on what he or she likes or dislikes. In person-centered care, workers should care as much about the client's feelings as they do about the client's health. The worker should focus on the client rather than on the client's problems. Workers have to remember that the workplace is the client's home, and the worker should treat the client as someone with unique wants and needs. Now, what are clients' rights? They have rights while they are in their own home. Rights are powers or privileges. Some rights are granted by law. Example is ADA. Other rights are based on the idea of the person-centered care, like the right to information, the right to participate in their own care, the right to dignity and respect, and the right to be safe, including the right to be free from abuse. Right to information. They have the right to information like their diagnosis, care, and their treatment. Any information about any planned changes to their care, even before the changes happen. They have the right to the provider's policies as well as what fees will be charged. Those are the information that they have to know. They have the right to participate in their own care. They have the right to say yes or no to care, helping plan their own care as much as possible. They have the right to complain about treatment or care without being punished. This means they can also complain if treatment of care is not given. They can give themselves medicine as long as it is safe to do so. And their right to dignity and respect, meaning they should be treated kindly and professionally. Their privacy and confidentiality should be protected, as well their property. They have the right to be safe, including the right to be free from any form of abuse, neglect, fraud, or financial exploitation. Now, confidentiality. Confidentiality in home care is required by agency policy and by law. Home health aides needs to be aware of maintaining confidentiality when they are talking on the phone, talking in public places, using computers, and doing paperwork or writing a report about clients. Keeping health information private means sharing private information about clients only with the people who need to know. This is required by law. And it's also the right thing to do. It shows respect for the client's privacy. Now, let's talk about promoting client independence. Promoting client independence is a key concept of home care. It helps clients to feel good about themselves and to stay active, both mentally and physically. You can promote client independence by not assuming that a client needs your help. Instead, ask the client what they want you to do. It is important for clients to make choices and do daily tasks as much as possible. This independence helps them be in charge of their own care. They feel good about themselves. And again, they stay active, both mentally and physically. Taking care of clients is a team effort. Some people see and talk with the client with direct contact. Other people do not, but their work still affects the client, having an indirect contact. The client or the patient is the most important member of the team. In most cases, clients can say what they want and help plan their own care. The home health aide spends more time with the client than any other member of the team. Other team members rely on home health aides or caregiver to tell them about any changes they see. In client's team, they may have the client's family. They may have the nurse, the doctor, the social worker, occupational therapist, physical therapist, speech therapist, care coordinator, nutritionist, and pharmacist. Now, let's talk a little bit about professionalism. Home health aides or caregivers have to demonstrate professionalism by showing pride in themselves and in their work, and by showing respect for the client. This includes being professional in the ways they look, talk, and act, and being on time. Being professional means being prepared every day to do your best work. This includes thinking about what things you should and you should not wear, preparing the night before to help you get out to work on time, having all the information you need to get to the client's home, and taking care of personal matters so that you'll not be interrupted or distracted at work. Your first meeting with a client is important for establishing a good working relationship. Remember to introduce yourself. You may wear a name badge. Refer to the client as Mr. or Mrs. Smith, example, unless they ask you to call them by something else. Use a friendly tone of voice. Stay focused on your job and explain to the client what you are going to do before beginning a task.